Sean and Christina, on Instagram, we've had lots of people reaching out about the side effects of medicine for epilepsy. So I'm going to name some of the common medicines, and then if you guys could just walk us through those side effects, that'd be really helpful.
Sounds good.
So the first medicine is Topamax.
All right, Topamax. Common side effects that can be seen, not always, but can be seen. Decreased appetite, decreased sweating. So in Texas, I like to use that one a lot because it's hot, especially in teenage boys. They may eat a lot. They're always sweating. They may have a lot of acne from sweating a lot. So if a patient like 15, 16, maybe you're heavier set, bigger guy, muscular guy, then I'll use topiramate or Topamax because decreasing the sweating decreases acne. They eat a little less, but this is probably only like in 2 to 3% where you get these side effects. So it's just using it to the benefit.
Absolutely. Okay, how about the medicine Keppra?
All right, Keppra. As a pediatrician, what do you hear about Keppra?
Oh my gosh, everyone loves Keppra because you don't have many side effects on Keppra. So I think it's a good one. You don't have to get levels. Like some of the medicines for seizures, you have to check levels, and doing blood work every so often can be stressful for pediatric patients and their parents.
Sure.
I speak from experience. And so I think having a medication like Keppra where you don't have to get levels is very helpful and just makes it easier for the physician and the parent family.
Yeah, and when you talk about side effects, whenever you say the word Keppra, parents usually are educated and they come knowing all the side effects from Google,
yeah.
which is okay, right? I think that's fine. But they'll say, hey, will it cause rage or anger or irritability? I say in about 2 to 3% of patients that use it, maybe a little bit higher, you may get some irritability and anger. I don't see it a lot in girls. I can see it in males, but it's not that often. But the good thing about it, it's very safe. You don't need to check levels, and you can get to high amounts of it without causing a lot of issues. So irritability, once the parent calls me and tells me that the irritability is insane, I usually will stop it, or we can add vitamin B6. Vitamin B6 has been shown to decrease the irritability of Keppra, or irritability of the kid on Keppra or the adult. But I kind of go with the flow and I really listen to the family. If the family's like, it is causing this, then we switch it.
Great. What about the medicine Lamictal?
Lamictal, that's a good one because it's safe. It's actually been shown to be one of the safer medicines during pregnancy. So a lot of females will probably be on Lamictal. Side effects. The main side effect that I tell my parents and patients to watch out for initially is it can cause this bright red skin rash. I haven't seen it because I keep in close contact with my patients. But I tell them if you start it in day 3, you start getting a little red, and then day 2, the next day more and more red, just stop the medication and it goes away. So that's like your most like concerning side effect of Lamictal, which is not seen often, but it can happen. And sometimes it can cause some increased appetite. So that's just something to really be aware of with patients.
Yeah, rash is like one of the things that pediatricians dread seeing.
Yeah.
Like when you see the chief
You're like,
complaint
"Oh,
is
no."
rash, you're like, oh my gosh, this
Yeah.
could be 500 different things.
Yeah.
But medication side effects, you always want to ask about what medicines are you on, because that could be one of the main reasons why, especially if you recently started the medication.
That's why dermatologists are so smart.
I know.
Yeah.
Literally,
There's
like
a ton of rashes. different
rashes
kinds,
are so
why,
hard.
how to treat it. But yeah,
But yeah.
Okay.
that's a
rashes
whole
are a good
that's a
point.
whole other subject, I guess.
Uh-huh.
Yeah. All right. Tell us about the side effects of Ethosuximide.
Yeah, that's right. Ethosuximide, that's a good one. So that's even hard for me to say sometimes. So like Zerontin, ethosuximide, that's actually the gold standard treatment for absence epilepsy. Staring off, 3 hertz spike and slow wave. Ethosuximide is the answer on the exam, our board exam. But they don't make it that easy. They're like, well, what's the side effect? The side effect is usually GI upset. So that's why if you start it, you need to start low. Start low, and over 3 or 4 weeks, target it and titrate it upward up to where you're not getting those side effects. Where people go wrong is they just start the full dose immediately. The kid's not going to feel good, and then they're going to say this medicine didn't work, and they missed out on an opportunity to treat it safely with one medicine. So GI upset, kind of like some vomiting I've heard, but it's usually like feeling like your stomach's upset,
Like nausea.
nausea.
Yeah.
But it's real. Like it happens. I hate it when people say, it's not causing that. It probably is.
Yeah.
So you just got to go with the flow and listen to the family.
Yeah. All right. Tell me about the side effects of Trileptal.
Trileptal is a good one for focal seizures or one-sided seizures. Side effect, there's two of them that I kind of keep an eye out and I educate families on when I first start it. One is it can increase appetite. So it's just being conscious of weight. And I haven't seen a lot of problems with that because I don't use huge doses. Or we talk about it initially, being active and controlling that. So that shouldn't be like a limiting factor. But the biggest one is it can cause hyponatremia, where the sodium in your blood decreases. That can make you feel out of it, drowsy, tired. So that's something to keep monitoring, but it's usually on very high doses, or if you've been outside dehydrated, or if you have a stomach bug and you're dehydrated. Those are moments where the family will call me and be like, "Oh, he's so tired. He's sleeping a lot." I was like, "Man, he's on Trileptal. Has he been sick? Has he been out?" Like, yes, he was out in the sun for like 2 days straight. I said, "Go to McDonald's and get something salty." I know
Yeah.
it sounds silly. Get something salty. It doesn't have to be from McDonald's. It can be from anywhere. But
Yeah.
eat it, and it replenishes that salt. And then they call me back. They're like, "That was it." But if it's super low and they're out of it, you got to stop the medicine and move on. It doesn't happen often, but it's a good thing to be aware of because you don't want that to happen and not understand what could be happening.
Sure. Christina, it sounds like with a lot of these medicines, there's an element of the parent, kid, adult, whoever's on the medicine paying attention.
Mm-hmm.
Would you rather me as a parent overanalyze everything and see a little red dot and go, "Oh, I got to call Dr. Marchesano"? Or would you rather me as a parent underanalyze everything and breathe? I'm putting you on the spot
I want
here.
you to be in the middle, okay?
That's fine. That's a great option.
I think it is important for parents to pay attention, especially when you're starting any new medications. Are there any changes physically to the child? Any unusual symptoms that have appeared? But it is a pattern thing, right? Like one little thing, we all have off days. We may get a headache here and there. If it's a pattern and it's happening regularly, that's when the parent should maybe raise some suspicion and talk to their doctor about it.
Yeah. Pattern.
That's a good point.
Yeah.
Patterns, trends, data. The kid saying things right after he takes it, after the hearing about the side effects.
Mm-hmm.
It can be kind of confounding in a way. So I think going with your intuition is the key.
But knowing the side effects is important. And Sean talks about this too, because if you know potential side effects, you can use them to your advantage, right? And if you have a child that maybe is sweating a lot, like he said with the older teenage boy, starting a medicine that decreases sweating, then you're helping the child's seizures in addition to potentially helping with other little things that they would be happy.
Yeah.
Sure.
So knowing side effects and using them to your advantage is a cool kind of thing.
And side effects, I never start a medicine without discussing real side effects that actually happen or could happen. I don't go through the list of like the commercials on TV where it's all
the scrolling
like
words
going,
death coming. It's not okay, right?
Yeah, it's always death is the last one.
Yeah, and I think they do that from a legal perspective, but if I were a parent walking into the office, I want to know what am I going to see? Because I'm not going to remember the list of 19 items.
Sure. What
are the top 2 to 3 things, and what do I do? So not just telling them these are things that may happen, telling them if it happens, do this. And our parents usually leave our offices empowered with knowledge.
Mm-hmm.
So they feel a little bit more comfortable. I think a lot of physicians will start medicines. Do you have any questions? Well, that's a tough one, right? Like
they don't know what to ask.
What do I ask?
Yeah.
Right? So then you're going home feeling you put your kid on a medicine, you don't really know about it, and you're looking for everything and anything. So I think they're scared.
Mm-hmm.
And when you're scared, the littlest things can be really scary.
Yeah.
Like make you afraid. So power comes from knowledge. So that's a really important thing.
Yeah, counseling is super important when you're starting a new medication. you want the family to feel like they understand what's happening and what potentially could happen.
Mhm.
And so I think that's one thing we really emphasize is the counseling part of it. I think that's like more than the actual like exam or anything else, right? I think is talking to the families about, we're going to do this. This potentially could happen. If it does, this is what you do. And like he said, that just empowers them and they feel confident that they're going to, try this. And hey, if it doesn't work, like this is the plan. We're going to be with you on the journey.
Yeah.
So that's important.
So, and I'll close on this. And, once we started posting a lot of stuff on Instagram, I get a lot of, not a lot, but several comments or people reaching out like, why are you pushing medicines? Medicines are bad. That's all you do. I hear you. I hear everybody loud and clear. My goal is to never start something that is not needed,
Mhm.
right? I don't want to start medicine. So, sure, health, sleep, nutrition, your environment, your mental state, all that stuff matters. All that stuff does have to be addressed in addition to medicine. So, medicine alone is never the answer.
Mhm.
Never, ever. So, I'm going to put that out there. It's never, ever the only answer. It's an addition to lifestyle modifications. So, don't be afraid. Never be afraid to ask questions to your doctor before starting it. And you know what? If they don't want to answer those questions, then you need to find someone else.
Yeah.
And that's the truth. I'm just
Yeah.
going to, piss people off, but I think that's where medicine does get a bad name. Families are actually scared to ask questions because they don't want to hurt the feelings of the doctor or feel like they don't trust them.
Mhm.
You got to ask questions. So ask away.
Yeah. Very good. Thank you guys.
Yeah.
Okay.